Welcome back to another edition of TCM Graduate TV. This is viewer question number 5. I've had multiple people ask me over a period of time, what are your top 5 acupuncture points that you use in the clinic? This question likely comes due to Miriam Lee having her own 5 top acupuncture points, and it's a great topic of discussion in general. I did write a blog post response way back when. However, this is a little bit more animated and I get to go a little bit more in depth in the video and show you how and why I use these acupuncture points. Now, I usually chart from top to bottom. What I mean by that is I will write a point prescription such as LI20, LI4, lung 7, spleen 9, stomach 40. This helps me remember what I did, because then when I go look for acupuncture points, I'm usually taking them out top down, as well as I write how many I use so I can count them in and then count them out twice. So starting from the top, 5 acupuncture points I use regularly in the clinic is GB20. So the number one reason I'm using GB20 in the clinic is because it's good for any head stuff, so any EENT. Eye, ear, nose, throat. It is a great acupuncture point for anything to do with the head. And I like to combine it with lots of other acupuncture points for the head, such as LI20, for any nasal congestion. Might use it with maybe GB14, extra head neck 5 Taiyang, extra head neck 3 for any headache. And of course, we can even extend its power to the ears. So SI19, triple warmer 17. Or even any TMJ, jaw discomfort, stomach 6, stomach 7. So not only are these my top 5 used acupuncture points in the clinic, just as a point protocol, but in my mind I'm thinking, wow, I can use GB20 to treat so many cool things, and I can always add it to augment my treatment if I'm doing other acupuncture points in the area. I'm going to erase this and we're going to get into number 2. So the second one, working our way again from top to bottom, these are not in order of importance, they're all really, really important in my clinic altogether, is LI4. Now, of course, LI4 being the key and command point for head and face. This is one of the best tonification acupuncture points on the body, including stomach 36. And I really like this acupuncture point because, again, so many things affect us in our head and with our nasal cavities and our ears or whatever. So if I need to, again, augment my treatment, LI4 is it. And also, LI4 is one of the top 3 acupuncture points that's going to clear heat from the body. LI11 and DO14 being 2 other acupuncture points that clear general heat from the body. Of course, LI4 pairs great with so many other acupuncture points, such as liver 3 for 4 gates, this opens all channels and collaterals, is great for generalized pain all over the body. LI4 pairs really, really well with GB20 and lung 7. This is the protocol I use for wind cold. Of course, we can do GB20 and triple warmer 5 for wind heat. And I'm sure you can figure out lots of great combinations that LI4 joins up with. Large intestine 20, of course. This is great for any nasal congestion, and of course the hand mimicking mimicking the face is a great channel to channel pair for anything to do with anything on the front of the face. So this acupuncture point, as far as I'm concerned, is extremely powerful. You got GB20, you got Li4. I'm going to erase this, and we're going to do number 3. Now, I know I said stomach 36 is one of my favorite acupuncture points altogether, and I've said this before, it's also the best tonification acupuncture point, but we're gonna skip it. And I'm gonna have to put something else in its place, and that's spleen 10. And this is for several reasons. Now, number one, I do treat a lot of women in my practice, and a lot of times I have to break up blood stasis. I have to help the body remind itself to control the blood. And there's so many patients that are suffering from blood deficiency. Of course, UB17 being influential of blood, this is sea of blood. I find it being used in the clinic a lot, and I just want to emphasize its importance. Of course, spleen 10 can be paired with PC3 to treat any skin condition. PC3 spleen 10, shout out to Dr. Kai if you're watching this, or if one of your students is watching this, say hi to Dr. Kai for him. Ask him, any skin condition, PC3 spleen 10, PC3 spleen 10. Maybe add in UB17 as well. But it's a great jump off acupuncture pair for any skin condition. Love spleen 10, using it a lot in the clinic. So GB20, Li4, spleen 10, just got 2 more. All right, this one's going to be pretty obvious, and the other one will be pretty obvious as well, but we got to get into it, and I got to let you know what it is. So spleen 6. This does everything unless the patient is pregnant, because it's one of the 6 contraindicated acupuncture points for pregnancy, and that also includes Li4. It's one of the 6 contraindicated acupuncture points. So spleen 6 does everything. And I'm kind of joking here, but what does everything mean? Well, the first thing it does, it's the 3 yin channel meeting acupuncture point. So it's a great acupuncture point to augment your treatment if you're treating yin deficiency. So of course we can treat yin deficiency with kidney 3, kidney 6, UB23, Ren 4, and of course spleen 6 will help you with that. Spleen 6 is going to treat spleen qi deficiency. So this is going to be great for sinking of spleen qi. This is great for bloating, digestive concerns, helps drain damp. And something that's really cool about spleen 6 is it helps calm the shen. So this is great for calming the shen. It's also great for sleep. So spleen 6 really does everything. Gonna erase this and we'll get into the last one. All right, last one, liver 3. Why? moves liver qi. Everybody needs their liver qi soothed. So liver 3 pairs really well, I said already, with Li4. Liver 3 mirrors the head, especially the eyes. It's great for eye concerns. In acupuncture theory, breaking up blood stasis isn't just about doing a spleen 10 and a UB17. We need to move the qi, and we know that the liver moves qi outwards and upwards in all directions. So this is great to augment your treatment if you're treating any stasis. So there you have it. My top 5 acupuncture points I use in the clinic, and why, and how I build off of them all. GB20, Li4, spleen 10, spleen 6, and liver 3. Comment, let me know on Instagram, let me know on YouTube, whatever it is, send me a DM, let me know what your top 5 acupuncture points are, and I want to hear from you. Thanks so much for watching this video, asking really great questions. I love having the dialogue that acupuncture and Chinese medicine gives us.